First one.
Okay, now I'll call upon
Thank you.
our Dr. Manpreet Kaur to start with her presentation.
A very good morning to all of you. So I'll be presenting my research on impact of vector thermal pulsation treatment on ocular surface microbial flora in meibomian gland dysfunction. There are no financial disclosures for any of the authors. So meibomian gland dysfunction, as we know, is a chronic diffuse abnormality of the meibomian gland characterized by duct obstruction, which results in altered tear film, symptoms of eye irritation, inflammation, and ocular surface disorder. The conventional treatment focuses on physical expression of meibomian secretions, heat, warm compresses, eyelid scrubs, topical antibiotics, topical steroids, and lubricants have been tried as well. So, the newer treatment modalities include eyelid thermal pulsation systems, which are handheld devices for controlled application and warmth and massage. Why? Because the conventional treatment of warm compresses, etc., compliance is a significant issue. Patients do not really follow your instructions. So, why is treatment of MGD important? Apart from optimizing the ocular surface, meibomian gland secretions are also a source of contamination with higher positive culture rates from both meibomian gland secretions and conjunctival cul-de-sac in patients with MGD. Staph epidermidis is the most frequently isolated organism, which is also associated with endophthalmitis. So our purpose was to evaluate the impact of vector thermal pulsation treatment on ocular surface flora in meibomian gland dysfunction. So this was a prospective interventional study performed at Dr. Rajendra Prasad Center for Ophthalmic Sciences, All India Institute of Medical Sciences, New Delhi, in 40 patients with mild to moderate meibomian gland dysfunction. A single sitting of 12-minute vector thermal pulsation treatment was provided. Meibomian gland secretions were sent for culture and MALDI-TOF analysis for before treatment as well as 1 and 3 months after treatment. Inclusion criteria: mild to moderate meibomian gland dysfunction with less than 50% gland area loss as analyzed by LipiScan and a lipid layer thickness of less than 75 nanometers. Any ocular surface disorder, comorbidities, ocular infection, prior surgery in 3 months, inflammation were excluded. Primary outcome was the change in conjunctival flora with vector thermal pulsation treatment. Secondary outcome measures were change in ocular surface disease index and clinical signs: tear breakup time, Schirmer's, lipid layer thickness, ocular surface staining, visual quality, and meibomian gland dropout. So there was no significant change in the visual acuity and quality at 1 and 3 months after treatment as compared with baseline. When you look at the change in microbial flora, pre-treatment 87.5% meibomian gland secretions were culture positive. Culture positivity reduced significantly at 1 and 3 months. When you look at the MALDI-TOF mass spectrometry, there was a change in microbial flora after treatment. Of note, Staph epidermidis, aureus, hominis, and capitis all were isolated before treatment, and post treatment at 3 months, only 12 patients had Staph epidermidis. Ocular surface disease index reduced significantly, that is, improved at 1 and 3 months. TBUT, Schirmer, and NEI corneal staining improved significantly at 1 and 3 months. Meibomian gland dropout and lipid layer thickness improved at 1 and 3 months for the lower lid gland loss, not the upper lid gland loss, and this improvement in structure can be attributed to the restored acini activity. So just to conclude, the culture positivity of meibomian gland secretions in 95%, 38 out of 40 cases, with Staph epidermidis being the most common cultured organism. A single sitting of 12 minutes of vector thermal pulsation treatment significantly decreases the ocular surface flora in meibomian gland dysfunction. There is an associated decrease in dry eye severity as assessed by the OSDI score and improvement in ocular surface stability as evidenced by improvement in TBUT and lipid layer thickness. The beneficial effect of a single sitting of vector thermal pulsation treatment persists 3 months post treatment. Vector thermal pulsation therapy may be performed in MGD patients prior to ocular surgeries within 3 months to optimize the ocular microbial flora. This was the first study to evaluate the impact of heat and pressure therapy on ocular surface flora in patients with meibomian gland dysfunction. Thank you for a patient hearing.
During this follow-up period,
Was the usage of antibiotics avoided?
Yes, sir.
Was it ensured that they do not get antibiotics
Yes,
during
sir.
that period?
Yes, sir.
And why did you just this cutoff age is this 18 years? Because we also did around the age of 12 years, 14 years also we did this LP flow treatment, and the results are quite gratifying.
So we included only adult patients in our study, so that's why.